It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area, Candace, that help change people's lives.
You bet they do. And our first story is with plastic surgeon Dr. Robert Wilcox.
When we do breast augmentation, one of the most common complications that we're trying to avoid is capsular contracture. And what that means is when you put in an artificial device in any person, whether it be a breast implant, a pacemaker, or an artificial joint, is the body makes a layer of tissue around it called a capsule. That happens in the first week, and that's the patient's own tissue. And that's a normal response. Unfortunately, in a minority of patients, that capsule can start to contract down and harden. So the breast implant, instead of resting on the chest like a dome shape, becomes rounded, pulls up, distorted, and can become painful. After breast augmentation, there are certain measures that are employed to try to prevent capsular contracture, and most commonly is to massage the breast implant daily. Nevertheless, probably about 20% of patients over the next 5 to 10 years are going to get that hardening. Now, traditionally, it's been taught that the only way to correct that is to go back into surgery and surgically remove that scar tissue and replace the implant. The Aspen after surgery actually gives us a non-operative measure to treat that. And what is involved is this: the impetus for that contracture or hardening seems to be bacteria, and it can be seeded from the breast because it's an open gland into the environment. It's the bacteria that's found on that capsule is normal bacteria found on the skin. But what happens is when it lands on that implant, it acts differently than bacteria elsewhere in the body and forms what's called a biofilm, like a shell around it, so that the antibiotics can't eradicate it. What the Aspen after surgery treatment does is an ultrasound device specially designed for the breast that imparts energy in to break up that biofilm so that the antibiotics we prescribe can then eradicate the infection and soften up the breast implant again. Now, when we see patients, the success rate of this depends on how severe the contracture is and how long they've had it. But in the typical patient that comes to us, if it hasn't been too long, if it isn't too far advanced, but it's distorted enough that they can see the distortion and feel the hardness, we get about an 80% response rate.
I was in a bad car wreck in 1985. A drunk driver hit me, and I wasn't hospitalized, but it was, I took a pretty good hit to the neck and head. My life had got to a point where I couldn't even walk around the block without being in neck pain. I was having a lot of difficulty at work. I'd been playing water sports, and it got to a point where I just had to give them up because it was just causing too much pain for my neck.
When Monty came to see me, he was complaining of a lot of neck pain, and arm weakness. We looked at his MRIs and x-rays, and what we found was a disc herniation was hitting part of his spinal cord and his nerves, and that was causing the pain shooting down his arm.
We had waited several years for the technology to get better because all the doctors had turned us away, but when we came to Dr. Rimlawi, he explained how technology was real advanced now in the neck surgery area.
Because of new technologies today, we can perform surgeries that are muscle sparing. And that really is huge because traditionally, surgeons cut through muscles. And what we realize now when you do that, that really causes a lot of bleeding, which leads to scar tissue, leads to more pain. So we go in between muscles. And there's a muscle going this way and a muscle going in here. And we go in between the muscles and get down to the neck, And they were able to shave off bone spurs, take out a disc herniation that's hitting the spinal cord, free up nerves, put in new discs if we have to, and stabilize the neck. And doing that, it makes it much easier on the patient, much quicker recovery, less blood loss, less scar tissue, and it's just not as painful of a surgery at all. And a lot of times patients really experience very little pain.
I'd had surgeries before. So the day of my surgery, it was only supposed to be about an hour and a half long, so I wasn't really nervous, but I was excited to have it over. And so when I woke up, that's the first thing they asked me if I had neck pain, and I had no neck pain. So after 10 years of neck pain, I'm finally able to go back to a normal life because of Dr. Rimlawi.
For more information on any of the doctors you've seen on today's show, be sure to check out our website, bestdocsnetwork.com. And now we're going to check in with our next best doctor. It's minimally invasive general and bariatric surgeon, Dr. Preeti Malladi.
I decided to enter the field of bariatric surgery and focus my practice and also become specially trained in this field because it has such a profound impact on patients' lives. Patients have been struggling for years with multiple medical conditions and sometimes even low self-esteem. And when they come to my office, I can offer something that really can be successful for them.
I decided to have the sleeve procedure when I got tired of being tired and not feeling good. With me being overweight all my life, I had a doctor tell me one time, he said, "Vicki, your knees were not designed to carry what you are making them and have made them carry your whole life." Before I had the surgery, it was always hard going on vacations because walking anywhere, I can remember a few years ago, I went on a trip to New York with my daughter and I thought I was going to die. Needless to say, I was always the straggler. We did everything through the subway, up and down the stairs. It was horrible.
So it's really exciting to work with patients and then perform surgery and also work with them for their lifestyle change and then see the changes happen. And the great thing about bariatric surgery is that I have a lifelong relationship with patients. I see them post-operatively, I see them for years afterwards, so I can see how they're doing in the short term and in the long term, and see them come off their medications, see them lose weight, see them gain energy and feel great about themselves. And the most important thing is that they're able to live longer, have a better quality of life in the end, and be able to enjoy that with their families.
Dr. Malladi, I just can't say enough good things about her. She is a genuine person. She's a very caring person. If somebody said, "We were going to shoot you if you do not say something negative about her," I'd have to go, "Shoot me." I've lost, since I've had my surgery, 85 pounds. I feel fantastic. I feel like I look good. I just feel so much better. I feel alive.
Find out more about your family history. Finding out what your grandparents died of can provide useful and life-saving information.
Plantar fasciitis is actually just inflammation of the plantar fascia, which is the large ligament on the bottom of your foot that goes from the base of your heel to your toes.
I was doing fine until I kind of changed my routine and started running again. For the longest time, didn't really feel any heel pain, and then all of a sudden, just really sharp pains, after I'd be done.
The more common signs or symptoms are pain with first step in the morning, pain after being on your feet for extended periods of time, or even later in the day, pain after taking short rests and getting back on your feet.
I started with some treatments, started with, just doing cortisone shots, did a series of those, as many as you can, which is about 3 shots. That didn't work. Then I said, okay, well, let's just try, physical therapy. Did physical therapy for several weeks. That didn't really work, and so we came to doing this treatment.
EPAT is, it stands for Extracorporeal Pulse Activation Treatment. It is a highly effective, non-invasive treatment performed for plantar fasciitis. It works basically by a set of unique pressure waves, and what it's doing is increasing and enhancing circulation to the area and promotes the healing and speeds up the healing process. It's performed in the office. It generally takes 3 treatments, which we do 1 treatment per week for 3 weeks. Has a success rate of over 80%, and there is really no downtime or risk with the treatment at all.
When you come in, you're here maybe half an hour, and the treatment probably takes 10 minutes at the most. You know, but by the time they set everything up, you get in and out, you're in and out in about half an hour. So, you know, as you're coming through, you do 3 or 4 treatments and then you're typically done. So I've had 3 and I'm on my last 1 round.
She's done very well. In fact, I think she's back to most of her activities and really is pretty much pain-free.
As always, for more information on any of the doctors you've seen on today's show, and Jim, you can also request an appointment. Be sure to check out our website, bestdocsnetwork.com.
Bestdocsnetwork.com, that is the place to go to find some of the best doctors in the entire Dallas-Fort Worth area helping change people's lives, like our next doctor, neurosurgeon, Dr. Jeffrey Cattorini.
My brother was diagnosed with glioblastoma tumor, and I started visiting him in California. And after the removal of his cancerous tumor, I started realizing I was having some issues with myself. Felt like a light pulsating headache, but it wasn't painful. A little bit of pain in my calf, and my neck was just bothering me. I saw my chiropractor. After about a month, he said, "Stella, I'm really good at adjusting necks, but for some reason why you're still having some issues and not getting any relief." He says, "I highly recommend you get an MRI." After about 2-3 weeks, I went ahead and agreed because the pain was just too painful. He calls me up a couple days later. He says, "Stella, you're right. You have some neck issues. You have 2 bulging discs, but in addition to that, you have a tumor."
Spinal cord tumors fall into 2 main large groups. One in the canal, which is what's called intradural extramedullary, but it's inside the covering of the spinal cord, and then pressing on the spinal cord from outside. And then another one is intradural intramedullary, where the tumor is within the covering of the spinal cord and then within the spinal cord substance itself.
And he explained the longer it stayed in me, it's going to press more and more against my nerves, and that's why I'm going to start to have more and more problems. Dr. Cattorini, if I was your wife, what would you suggest? And he said, immediately take it out, and that's exactly what we did.
This is a model of the back of the skull, and then the front of the neck, and then the back of the neck. Stella's tumor was within the spinal canal itself. It was actually within the spinal cord itself. It was at the C3, C4 level, and these are lamina that were removed. We removed 2 of the lamina, making a small incision, localizing it here, opened up the covering of the spinal cord, and then went directly into the spinal cord itself to remove the tumor.
I just feel confident that whatever I had or whatever I may get in the future, I know I would always rely on him or go back to him.
Prosthodontics is the name of the specialty, and it's one of 9 dental specialties recognized by the American Dental Association. It's a specialty that requires 3 years of additional training at a dental school level. It's 3 years dedicated to the specialty of prosthodontics, which is reconstructive dentistry, including dental implants, crowns and bridges, dentures and partials, some TMJ treatment, and other small areas of dental reconstruction that most people will never need. A typical patient that finds our practice has needs ranging from fillings all the way up to full mouth reconstruction. We handle everything in-house. By having everything in-house, we have total control of patient outcomes, and that's our main goal here, is to have fantastic outcomes. One of the biggest strengths of my practice is the amount of time we spend with each patient. It's all about education here. Every new patient is scheduled for 1 hour, and we go through their complete diagnosis, their treatment plan, and we attempt to educate them on all the options that are available. And it's one of the things that I enjoy the most about my practice is getting to know the patient and helping them understand their problems, but also giving them several different options on how to fix their problems. We often have multiple try-ins so that we don't just make the patient look good, but we make them look fantastic because we've taken the time to pick the right tooth size, tooth shape, and tooth color that fits their complexion and their facial shape. Another way that my practice significantly departs from common implant treatment is that I do everything myself. I do the planning, I do the surgery, I do the teeth. It's all me and my hands fabricating these restorations for the patient. There's not a laboratory technician that comes in during the procedure, and no one else touches the patient's care except me. We're committed to patients having long-term success, so we do provide all phases of services, including cleanings and maintenance. Often I frustrate my patients because I'm so picky about their outcome that we sometimes have to make changes or we have to redo the restoration if I'm not satisfied with it. But it's important to me that we get it just right for every patient, whether it takes extra time or not.
Chest pain can be a scary thing. There are bad causes of chest pain and not so bad causes. So how do you know the difference? Well, generally the bad causes of chest pain, for example, a heart attack, occur with a gradual onset. For example, the discomfort comes on gradually and then goes away gradually. It's usually exertional when you do things like run up a flight of stairs. It's usually dull, not sharp, and that means not like a knife. Knife-like chest pain doesn't tend to be heart-related. Also, if it's heart-related chest pain, you'll tend to get other symptoms like shortness of breath, you'll get a cold sweat, you might even get nauseated or have the pain go to your jaw or to your arm. Now, non-heart-related chest pain is a lot easier to figure out and not nearly as scary. For example, it's usually sharp, it's usually sudden, it's usually aggravated by motion. For example, if you have chest pain that's worse when you move or reach or bend or arch your back, that's generally muscles or nerves, and that generally lasts longer. So that's the way you can figure out whether it's heart or not heart, that and whether it's exertional. If you go up a flight of stairs and your chest pain gets worse, and that's pretty predictable every time you go up a flight of stairs, that may be your heart. Check that out, especially if you're older.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab. Don't forget, for more information with any of our fine doctors you see on today's show, even request an appointment, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. All right, time to move on to our next best doctor, one of the top plastic surgeons in the Dallas-Fort Worth area. It is Dr. David Azouz.
I had a condition called true gynecomastia, and the condition is basically a hardening of tissue in the chest area. And so unlike some of the other people that have that, it was actually hard tissue, it caused pain, and it was pronounced through clothing, things like that. It was more pronounced on one side than the other, and so that kind of began the search where I looked for doctors for about 3 years.
Gynecomastia is a very common problem for many men where they have the physique in their chest that's more female or feminine, and that's why it's called gynecomastia, feminine breasts on men. And obviously most men are not happy to have breasts, and they want to have that corrected. So they like to have prominent pectoral muscles, they like to show a lot of musculature, but they don't want to have breasts.
So I talked to my primary care physician, and then I started to look at different plastic surgeons in the Houston and the Dallas area. And without even examining me, most of the doctors would tell me the procedure right off the bat, and usually that entailed to do multiple cuts around the area, multiple incisions, and then go in and from all angles kind of, take out that tissue. So I knew that that wasn't something that I really wanted to do because it was going to leave a lot of scarring. So I put it off, and it ended up, like I said, it took about 3 years. And the first time I went into Dr. Azouz's office, he told me flat out, I'm going to, stay here until we answer all of your questions. And he kind of went beyond that. I mean, he came up with questions that I wasn't even thinking about. And within a few minutes, I knew he was the man for the job. I mean, he actually examined me before he made any recommendations. And then he kind of went through the whole procedure. And the procedure was going to be, you know, 2 really small cuts, which I kind of didn't believe at first, to be honest, because I'd been told by so many other doctors that that wasn't possible, that they would have to do multiple incisions.
And what we do is we take off the breasts by making small incisions under the areola, and through liposuction and sometimes excision as well, we remove the breast tissue and we give them better contour.
Now that the procedure's done, you know, all I have is praise and thanks for Dr. Azouz. Without him, I would have probably gone to one of the other doctors and been unhappy with the results. My life has truly changed as a result of this procedure, and I would highly recommend it to other people.
If you have asthma, do not let it stop you from playing sports. Swimming, canoeing, fishing, sailing, and walking are all asthma-friendly options.
In our practice, we really emphasize patient autonomy. We feel it's very important, probably the most important thing we do. We want the patient to be involved with every step of the process in our office so they understand the nature of their skin cancer, exactly what it is we're going to do in order to remove the skin cancer, and what their options are after the skin cancer has been removed.
I have had skin problems for most of my life. When I was young, I tried to always get a suntan, but instead of getting tan, I got sunburn, and then I would just peel off.
Reverend Turner is a fine gentleman who has very fair skin and has had a lot of time outdoors, and he's developed a lot of very superficial squamous cell and basal cell carcinomas, predominantly on his scalp. Once they're diagnosed, we've removed a number of them using the Mohs technique.
It's very effective. I'm glad that I could have his expertise in treating my problem.
Anyone that develops skin cancer should be seen by a dermatologist every 6 months. And that's because we know that skin cancer is due to exposure to ultraviolet radiation. And unless you have left the rest of your skin someplace else whenever you got sufficient sun exposure to get your first skin cancer, all the rest of your skin that was there is susceptible to the same mutations that gave rise to the skin cancers.
I'm 79 years old and I'm still here. He's helped me to get as old as I am.
Hi, I'm Dr. Preeti Malladi with Best Docs Network. Did you know that obesity can increase your risk of sleep apnea and that bariatric surgery can help? To learn more, watch my videos on bestdocsnetwork.com.
And welcome to the Best Docs Network. In the studio, we are proud to have Dr. John Barnett, one of the top plastic surgeons in the entire Dallas-Fort Worth area, known for creating some of the most beautiful breasts in the world. What makes a beautiful breast?
Looking natural, feeling natural, and acting natural. By that, I mean when the woman moves, they bounce.
All right, Dr. Barnett, you use saline implants and you put them on top of the muscle. Why do you do that?
The saline implants, you have an adjustability factor. Most women are asymmetric in the breast. So you can get them to where they look equal almost exactly equal. You can't do that with a gel. You got to order different sizes, and they don't come in 10 cc increments. So it's very difficult to get the size right by eye. As good as I am at that, I can't just eyeball it exactly how many cc's difference. Okay, number one. Number two, that's how everybody was taught to do it on top of the muscle. It sounds like a logical idea, but it's a false assumption. It doesn't work. Here's why. Skin stretches. That's why you can take somebody who's really flat-chested and turn them into 34, 36C. It looks great and natural. The skin stretches, but so is that muscle stretch. It starts out about like this, and then it ends up about like this. But there's no going back from that, okay? It still retains some contractility. That's why when they flex their chest wall muscle, the implant will move around. Looks really nice, really natural, looks good. So when you put it under the muscle, it's an anatomically and physiologically abnormal thing. If a woman's breast is a little bit low set, you have what's called Snoopy's nose effect. Your breast sort of falls off the end. Here's the implant way up here, and the breast sort of falls off. That's why a lot of people get breast lifts in association with their augmentation, because the surgeon's trying to make the patient fit the operation rather than the operation fit the patient. You know, a lot of people got a lot of scars on them that they didn't need.
In the aftercare, it's really important to me to see the people and to just touch base with them to see how they're doing with the program. We know that they have to do certain things, and sometimes they don't recognize exactly what they're doing that's not in the program. Paying attention to what they're eating, what they're drinking, making sure that they're working on exercise and changing habits, dealing with stress. With this surgery, it's not just surgery, it's lifestyle.
Dr. Swanson's been there every step of the way. When I had my post-op appointment, he asked all the right questions. He wants to know how much protein, how much water, any discomfort, any pain. If there's pain, okay, well, when you had the pain, what did you take? And he wants to know in case, there are certain medications that might cause complications.
So in this office, I have a dietitian, so we can have on-spot help in food choices and portion sizes and measuring grams of protein and calories, all those sorts of things.
Even though I may not have a scheduled appointment, I'm welcome here to come and see him anytime. That support is there. If there's a new product or something like certain supplements that are out there, if I don't want to commit to them, he'll say, well, try this sample and see how it works, and then come back and let me know.
That's what we do here, is we're trying to help you modify those little things. We see people back pretty regularly. I see them in a week. Dietitian sees them at about 2 weeks. I see them again at a month or 3 months, and then again regularly, and I want to see them every year. I love to see them. It's important to me. I get a real bonus personally from seeing these people. I think it helps them. When they come in and they get to talk about how they're doing, and the changes, and what's going on with their life, I think that's great.
All right, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And the good news is, Candace, for more information about any of these doctors, the folks can head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
That's where you need to go. And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.